Okay, so welcome. My name is Eric Lands. And I'm part of the LHD support team. And today, we're going to go over a few things. First off, we'll go over the objectives and we'll do some introductions. We'll talk about the application deadline and a few other times that are important, as well as some guidance. We'll go through an update to the VDH intranet. We'll have some recommendations and incentive management from the Office of Procurement and General Services. We'll allow you to ask some questions and we'll give responses to some frequently asked questions for procurement. And then we'll have a couple of next steps. So today, our objectives are to review that upcoming application deadline I spoke about and have some available resources. We'll communicate the procurement best practices. And again, we'll provide that open forum for you all to ask us questions. So joining us today, we have Arden Lin, the Division Director of Procurement, and Kimberly Bomey, Procurement and Admin Manager. In a couple of slides, I'll allow them to introduce themselves, but they are here from the Office of Procurement and General Services, and they'll be our subject matter experts to answer some questions. So important dates here. First off, thank you to everybody who had some one-on-one conversations to determine those ongoing needs for the community engagement specialists and community epidemiologist positions. Those have all been completed as of yesterday. So to follow up on that, we would really appreciate those who did attend the conversations to complete a short survey to input your funding needs, and that's due by November 1st. And you should have already received that. For community engagement specialist position, we would like you to know that only salary and overhead expenses should be included in the annual request for that position. Expenses like visa, travel, supplies, those should all be included in the community engagement application budget. Important deadline here, it's a big one. Application for this ARPA funding is Thursday, November 10th, 2022. So as you all know, LHDs may submit a one-year work plan or a multi-year work plan that covers up to 4 years, and that would be through December 31st of 2026. Again, an important note here is that spending must be consistent with general ARPA guidelines, and all your funds must be obligated by December 31st, 2024. After that date, any costs incurred must result from existing contracts or an MOU. And the last date here that's important, tentative right now, but we know early December, we're going to have funding decisions and memos delivered to you all, the LHDs. Important one here coming up, though, again, just to reiterate, November 10th, that funding request application will close. So important to get those in. So here's an update regarding the VDH intranet site. You'll notice on the right-hand side, there's a targeted community outreach link. And once clicked on that link, you'll be able to get some grant information and additional resources. Those are now up and live on the VDH intranet webpage. If you do have any questions, you can always reach out to tco.comengagement@vdh.virginia.gov. The people behind there will be able to answer all your questions. And so we appreciate you guys asking anything you have. We want this to go as smooth as possible. So we want to get those questions answered for you. And with that, I'd like to pass it over to both Kimberly and Arden. If you guys wouldn't mind, just introduce yourselves and take it away.
Thank you, Eric. This is Arden Lin. I am Division Director for Procurement here in OPGS. I am relatively new to the entity. I came in February of this year, and I come from VDOT. So I look forward to working with everyone. Thank you. Oh, and Kim is sending us all a message. She says, "Hi, this is Kim. I'm afraid I have no voice today." Understandable. All right, so Eric, if it's okay, do you want me to just go ahead and start talking about the procurement methods available?
Absolutely.
Okay. All right, will do. All right, so in terms of partnering with members of the community, nonprofit entities, or entities of higher education or other state entities, we have a few options. I think the best option is probably what we call a request for application. There's also some government to government contracting opportunities. And as kind of a last resort, there's a sole source method. So just to go over the slide that's here, what we like to say in procurement is that the goal of procurement is to acquire the necessary goods and services at a reasonable negotiated price within the necessary time frame. So we want everything to be just what we want, just what we need, and just in time. So as I said previously, my suggestion for partnerships through the ARPA grant funding would be to establish subrecipient agreements through the request for application process. And that's similar to a request for proposal process in that it requires that we have kind of a scope of work, we have evaluation criteria, and it also requires that we evaluate the applicants. But this allows us to kind of advertise the opportunity widely, and also to, as I said, evaluate and make sure that we're getting the best partnership we possibly can. Kim, did you want to add anything here? And I'll read it out if you want to just type it in. Okay, well, if she doesn't have anything to add, I will say that there is a process for doing a request for application, and there is an explanation of that process available on the OPGS forms part of the internet site. And Eric, I don't know if you're able to pull that up at all, but if I can share the presentation, I can also pull that up. Or we can just provide the link at a later date if that works.
I'm not sure I have that one actively available. You can feel free to share your screen. I'll that should be good to go. Or we can share the link as well. Up to you.
Yeah, we can definitely share it afterward. I just want to make sure that everybody's familiar with the internet site and just show them what it is, if that's okay for a minute or two.
Yeah, go for it.
All right, thank you. All right, can you see the screen now?
Yep, I see it.
Perfect, okay. So from the homepage, you would click on OPGS, and then scroll down toward the bottom of the page, and under procurement here to the right, there's procurement policies, procedures, and forms available. If you click on that, it takes you to a complete listing of all of our forms. And here, you can find information on the RFA process. I suggest starting here with the RFA job aid, but then there's a sample so you can see what goes into an RFA. And then if you're in a position where you may need to approve of an RFA, this is an excellent resource for you. Okay, and that's really all I wanted to share at this point, so I'm going to stop. All right, Eric, back to you.
Awesome. Arden, would you like me to go to the next slide here?
Sure.
Cool.
Okay, and I think with regard to incentive management and the purchasing and managing of gift cards, Kim provided us with an excellent tool, and Eric, I think you were going to go over that. So I'll hand it back to you for that.
Sure. So as far as Arden said, gift cards, there is some information that we would need to collect if this is the route the LHD wants to go down. So the first thing I will share here, and let me pull it up. Is we have a gift card log here. So this is an example, and what's important to know here is that the mandatory fields are the gift card number, the gift card value, the name or the ID of the person who received it. And so this is just a template, certainly something that can be used throughout the LHDs, or it could be modified on behalf of the program, just as long as those mandatory items are included. But if you'd like to include anything else, for instance, there's a second tab here, and we can see that we have a tracking sheet for clients to initial or even sign. Again, that's up to the LHD, but again, important to know that gift card number, value, and then name or ID of that person who received it is going to be mandatory information to be collected. So I'm going to go back over to the presentation again. Great. And anything else you wanted to go over, Arden, regarding this incentive management?
The only thing I will say at this point is that if you have specific questions about gift card purchase, etc., I would suggest contacting Elizabeth Frigard here in OPGS. She is our SPCC program administrator, and she will have all of the answers.
Awesome. Thank you very much.
Eric, do you mind if I add one thing before
absolutely.
we do that?
Sure.
Arden, I think you also mentioned that if you are interested in doing incentives and more specifically gift cards, one thing to just make note of is that we'd recommend planning that as much as in advance as you can, because there is an approval process to be worked through with DOA. So just keep that in mind. But like Arden said, Elizabeth's a good contact moving forward.
Thank you. Yes, that's an excellent point. Thank you.
All right. And next here, we have a few frequently asked questions. Arden, I'll go ahead and read the questions. And if you want to go ahead and give us those answers, it'd be awesome.
Sure thing.
So first question, with emergency procurement being limited, how should LHDs approach quick turn procurement needs, and what is the typical timeline for procurement?
I think timeline's a difficult question to answer because there are so many variables. But as I said, the recommended procurement method in this case would be your RFA. And I think that there is probably going to be a 30 to 60 day time frame on that, just depending on how long it takes to draft and what the approval flow is, etc. Plus, once it's posted publicly, then we'll need to allow time for potential partners to respond. So I would look at 30 to 60 days for something like that. There are a couple of other methods, as I've mentioned. Government to government purchases and agreements are exempt from competitive requirements. So we can do MOUs and MOAs with other government entities. And Kim has actually provided the group with an excellent template for use with partnering with universities. So if you're interested in partnering with universities, we can definitely share that template with you. There is a non-competitive negotiation method of procurement called a sole source. But that's really reserved for instances where that entity is the only entity in that space and there is no other option. Okay.
Awesome, thank you. And I think you touched on the public university there.
Mhm.
So let's go into number 3 then. What are tracking and reporting requirements for managing gift cards and incentives? I can kind of go ahead and take care of that one. We talked a little bit about that on the last page, and I see there's some good conversation going on that in the chat. It looks like there's a specific question here that says, looking at the login requirements, we don't need any sort of signature from the resident or receiving the gift card. I would just follow up with that and say, right now, mandatory fields are just that gift card number, value, name, or ID of the person who received it, but no, it isn't required. And thank you, Kim, in the chat as well. So for the fourth FAQ, what is the best mechanism to provide a funding to a pre-identified organization without entering a competitive bidding process?
Well, I think we've kind of touched on that in one. We have basically those 3 methods: the request for application, the government to government MOU or MOA, and also the sole source. And, the request for application is in essence a competitive process because we are publicizing the opportunity and then we are evaluating potential partners. So it's competitive, and that would be the way to go.
Awesome, thank you. All right, with that, I wanted to open this up to you all, the group, the LHDs. If you have any questions, please feel free to raise your hand, put them in the chat, or if there's a lull in discussion, feel free to just come off mute and answer your question. So I'm looking forward to hearing what you guys would like to know. And thank you, Kimberly, for answering those questions in the chat. Looks like she got all those questions from Melissa answered, and she's headed out now. So appreciate your time today as well.
Hi, this is Jessie Brennan. I'm from the Chesterfield Health District, and I had some questions. Can you explain the eligibility requirements around who we can or cannot pay?
Arden, do you have the answer to that question? If not, I can pass it to someone else from another team as well.
As far as eligibility requirements, that sounds like it's more a grant related question than a procurement one. Am I right, Jessica?
Yeah, you might be right. I'm asking questions on behalf of our manager who wasn't able to make it. So it may be that I'm not totally understanding what she was asking me to ask.
Okay. Kim put an excellent point in the chat. I don't know if you've got your chat window open, but Kim also contributed that in order to pay someone, we need for them to be registered in EVA. And the EVA registration process is something we can assist you with.
Okay, thank you.
Mm-hmm.
This is Claire Nick. I would also just chime in from a grant perspective that the way we've thought about like incentives is one group of spending that we've thought about how you could provide incentives to residents to remove barriers to attend programs. The idea for that though is it would be it's not really meant to be like an ongoing spending. It's not a stipend. It's more like if you need someone to participate in a focus group or you want to remove barriers to coming to an event, you could provide a gift card or a transportation voucher. So that's one group of people you could pay. We've heard some LHGs that are interested in forming partnerships with CBOs There could be payment as part of that like formal relationship if they're providing like services or infrastructure as an early stage of growing that relationship. And then like one of the other buckets we've talked about is people who are providing specialized skills. So sorry, I see Kim's note. Correct, not paid. I guess I meant expenditures. But another group, I guess, that we've talked about is if you were to bring on a contractor to do like a needs assessment or a program evaluation, that is likely to be an academic institution or a private contractor that you bring in. You might bring in like a translator, so maybe you're paying for a translation service. So some of those groups, if there are specific questions, Jessica, you can feel free to send us an email. I'm not sure if that's helpful for what you were looking for.
Thank you, Claire. Yeah, I'll shoot you guys an email.
And I just want to take a minute to read out what Kim wrote in the chat. The people receiving gift cards are not paid. And we can also assist on a case-by-case basis with questions on how to procure services. Thank you, Kim.
Just a lull in some questions. I'm not sure how many people are monitoring the chat, so I'll just go ahead and read a question here that wasn't discussed yet, I don't think, over the phone. So one question asked was, would working with local governments fall into the same government-to-government category as working with universities? Would MOU be sufficient? The answer to that is yes. Local would count as government-to-government. And the follow-up question was, so a non-competitive MOU would suffice? The answer to that is yes. You would need to provide a cost reasonableness form with G2G.
Looks like Paul has a question.
Paul, go ahead if you have a question, if you want to come off mute.
Thank you. This is Paul Brumman from the Norfolk Health Department. And the question is, if we are working with within a strategy identified by a local government, and the strategies involve particular community-based organizations, we would like to be a multiplier for that effort using those community-based organizations. So the question is, to do an RFA may not be appropriate if we're limited on what community-based organization is allowed to participate in the engagement. So how would we do that if it's not a government agency? We can't put it out for bid or request for ideas, but yet we want to be engaged with these groups.
When you say that the entity may not be allowed to participate in an RFA, is that due to the type of entity? I mean, the RFA is not limited to government.
No, I'm sorry if I wasn't clear. So if let's say that we'll just take Norfolk for example, and they have an overarching strategy. Public health wants to plug into that strategy, and they have community-based organization A that has been trained, certified to do that particular engagement, and the health department wants to be an amplifier of what they're doing. So providing more money, and preferably including a public health component to what the local government has already started to fund this group to do. So there's other groups that in the community that may not be certified, but they're community-based organizations, and we want to go with a certified organization. So,
is there a way you might be able to partner with that local government and provide funding to that local government to then assist this organization?
yeah, I think that's where Melissa Dozier's question is coming from. If we're able to do that, if the government is not willing to do that, then We still would want to participate in the strategy and get engaged directly with the community-based organization without having to go through a community procurement process like we did with Cycle 4 funding.
Mhm. I think in that case, if you are able to justify that that organization is the only organization in that space, then I think sole source would be the way to go in that instance.
Okay, that's good to hear. I see Kimberly's message about the subrecipient.
Mhm.
The challenge we think we'll have with subrecipient is the requirement for auditing and record keeping, and we don't have the resources to be able to do that. It's something we try to avoid in the Cycle 4 funding mechanisms. So we contracted as for vendors to provide services because we didn't really want to go through the subrecipient because we didn't have resources to do it.
I think that this may be something that we would need to work with you kind of independently on. But I think that we can find a method to fit your circumstances.
And as we get into the closer to the nuts and bolts, who would be our best contact?
You're welcome to reach out to me and I can connect you.
Okay, thanks.
Mhm.
Thanks, Paul. And we'll have those email contacts here on the next slide. But with maybe 1 or 2 more minutes, is there any last minute questions that maybe we can get cleared up from Arden or Kim while they're on the line? Not seeing anything, we'll move on to next steps and we'll wrap up today's office hours. Reminders to submit that staffing survey. It's due November 1st. Important one also, that Thursday, November 10th is when your revised application is due. So please get those in. And we look forward to seeing you at our next office hours on November 3rd. So thank you very much, Arden and Kim. You guys were great today. Thanks for answering all those questions. If you have additional questions, please feel free to reach out to them. Arden and Lynn, we have their email addresses here, and I hope everybody enjoys the rest of their day. Thank you.
Thank you, Eric.
Yep.
And thank you, everyone.